All right, thanks everybody for coming to this session. This is part of our health and life sciences track. We've got a lot of great companies here and great things happening at the CRC around this life science cluster. So we're happy to share and talk about things in this sector. Matt Livingstone with business development here at the CRC. Got Jeff Conroy here. He's going to be talking about Embody, idea to exit in 9 years. And I'll just turn it over to Jeff. Take it away.
All right. Thank you. Hi, everyone. Good morning. I guess we have some people on somewhere. Hi, everyone. So great to be here. Love Virginia Tech. I'm a Virginia Tech dad. It's a bring your daughter to work day. Mary is a Pamplin 26 student. I have a 23 graduate who's working up in Northern Virginia. And I'm on the board of the Apex Entrepreneurship Center here and was a faculty member for 4 years, adjunct faculty in a master's program in biomedical technology. So love Virginia Tech and everything that's going on here. I'm a 25-year medical med tech entrepreneur, came out of Abbott Laboratory and the drug business and was the CEO for 25 years, have been starting companies, often ill-timed with reality. I started a social network company in 1998 that was a little early for social networking for life science business development people. I started an anti-infective company in the days before pandemics when the anti-infective business model was terrible and had good science, but not a big enough business opportunity. And then I started Embody in 2014. And so I'm just going to tell you a little bit about the story. And I thought I would start a couple of things. I like to think about what I want to hear if I'm interested in business out there. So we'll talk about really what didn't go wrong or what didn't go right, because most of the time things didn't go right. But I'll start with the sexy part first. We started a company in 2014. I had a problem that I fell in love with, which was I had been the president of a tissue bank and learned all about tissue banking. So if you're an organ donor, your big five, heart, lung, cornea, kidney, liver, all go through nonprofits into patients. What they don't tell you is that the long bones in your legs get taken and the tendons in your joints get taken and the skin gets, and those products all get turned into surgical products. So bad economics, bad business model. I helped a friend save a failing tissue bank. And in the process, what I learned was orthopedic surgeons were taking tendons from cadavers and using them to repair rotator cuff tears. And that most of the time it didn't really work. All it did was create scar tissue over the repair. So I kind of had a problem that I fell in love with, and it was all about how do we engineer a structure that would grow new tendon tissue instead of scar tissue. So the only difference, scar tissue is unorganized tissue growth, tendon tissue is organized tissue growth. Aligned fibers are what your tendons and ligaments are made up of. So I fell in love with this problem. I started a company to focus on engineering constructs that would grow new tissue over a rotator cuff repair, Achilles, ACL repair called Embody. The sexy part is we started it, we raised money, we got DARPA funding, about 26 million of non-dilutive funding over 5 or 6 years, and raised about $30 million. And then we sold the company in 2021, sold the company for $275 million. And what's crazy about that is the med tech equation for how do you build a $300 million asset is $1 million in revenue your first year, 3 million your second, 6, and then 12. I thought we'd be able to sell the company when we had about 12 million in revenue, which is what Stryker did most of the time. And what happened was, because of the scarcity for innovative products in the soft tissue space, we finished our $3 million year. So with 3 million in revenue, we got this $275 million transaction. The other thing that was super unique and the sexy part is that we did it as a 1202 qualified small business structure. So this was a stock sale So first stock deal in orthopedics since, let's see, Johnson & Johnson acquired Synthes, a giant German company, for $20 billion in 2012. There was not another stock sale since 2012. We were the very next one. And so what that meant is, as an IRC 1202 qualified small business, our investors, as long as they hold their stock for 5 years, from the time they acquired it in Embody to whenever they sell the stock in the new company, it's tax-free gain. No state capital gains, no federal capital gains. So what that meant is that our $275 million transaction was a $420 million value on a tax-adjusted basis. And so $3 million in revenue in 2021, 420 tax-adjusted basis value out. So that's the sexy part. The reality is that I started working on this idea while I was turning around this tissue bank. So that was 2012 and 13. I started meeting with DARPA, the Defense Advanced Research Projects Agency. I thought that I built a business case around the role of soft tissue injuries in naval special warfare, so Navy SEALs and SWCS. And DARPA bought into this, and with a business case around the role of the prevalence of these injuries. Anyone tear their rotator cuff or Achilles or ACL or have a tear? So if you tear your rotator cuff, there's typically a 90% chance you'll tear it again in the next 18 months, even after a surgical repair. And so that was why DARPA got behind us. We got a $12 million R&D contract initially. So I like to say my wife funded the company for the first year and a half, and then DARPA funded it for the next 3 years. And we didn't have to raise any money until we were ready to go into the regulatory process. And so we had a problem. We had this business case for DARPA. We had some interesting funding. It was really about building a team. The only way something like this happens is thanks to 60 people. We had 60 folks in our company that were amazing. And engineers and scientists and commercial people and quality and manufacturing. And the real interesting thing is, we used to say, anyone, it doesn't matter if you've been in the business 6 years or 6 weeks, you can change the trajectory of the company. And that really was true. It was also super interesting that, you get the culture that you focus on. So when you're building a team and you go from a 2-person company to a 6-person company to a 9 to a 2, you're at risk of changing the dynamic constantly. So you really had to stay focused on, what are our values? How do we communicate? What's the culture that we want? Otherwise, we wouldn't have been able to execute. And so for me, team was the #1 asset in the company. And again, as we got bigger and bigger, we invested more in communication and alignment. DARPA, if anyone doesn't know about DARPA, being in Virginia, we're so close to, DARPA is the moonshot factory of the DoD. And we ended up with, our non-dilutive funding was about $26 million over 4 years. So a $12 million 4-year contract. And what DARPA says is, they didn't give us 12 million, they gave us 20 chances to fail. And we would get, $300,000 or $400,000 every time we hit a milestone. And that turned into a second contract with DARPA. We were basically taking collagen. We're taking a protein isolated from calf skin collagen, and we were engineering it into fibers that were as strong as steel. And then we would organize those fibers into patches, into implants that would go over the top of a rotator cuff repair, grow new tissue, grow your own tissue. Your own cells would find that and grow new tissue. And so DARPA also opened up lots of other opportunities. AFWorks, the Air Force Innovation Program, the Army Medical Research Material Command, NIH, so, and Catalyst. So we'll talk a little bit, anyone who was in Alex's presentation hears about VIPC and Virginia Venture Partners and Catalyst. We got about $1.5 million in non-dilutive funding from Catalyst that was in partnership with Old Dominion and UVA. And then we've hired many, many engineers and PhDs from Virginia Tech as well. So that was great. Once we were able to get we had a problem. We knew with this thesis about the products we're going to create, we assembled a team to create it. We got it funded now for 4 years. And now it was about, how do we execute? What's the product development process? And how do we start to assemble the evidence that demonstrates that this is a fundable company, viable company, important company in the future? Most of the time, evidence in this business is preclinical and clinical data. So we had to do a lot of animal studies. And because it was a 510K, we didn't have to do any human studies. So we were able to do this just with rabbits and sheep in our models, which were great. And then as we were getting ready to finish our preclinical process, we came along to the point where we started to be able to need investors. And I had never been the CEO of a company taking money from other people. I'd only ever, well, one anti-infective company. At this scale, we had never done it. And so we ended up, our financing structure was probably familiar to lots of people. We did a $3 million convertible note that rolled into a $6 million Series A, so converted into a Series A. And I used to worry about stuff, I used to worry like about the cap on the note. My job is to protect value. And so I can remember having conversations, is the $3 million note going to have a $12 million cap, or is it going to have a $15 million cap? And we talked about, should we just have it be a 20% discount on the A and let it ride? And it's funny how things that seem so important were basically meaningless, because we basically closed that note structure, $3 million on a $15 million cap. And then we rolled that into a $6 million Series A with a $30 million pre-money. So if I had just gone with the 20% discount, we would have had a $24 million effective ceiling on that note. So stuff that seems to matter early really usually doesn't. And so we focused on execution. We rolled that into our Series A. And then Series A was all about finishing regulatory and getting ourselves commercial ready. And so that also meant in the med tech space, we had to hire, I needed a commercial leader in the product development process. Like we really had to think about, how are our products going to be better than the products that were used in the existing surgeries? And what language were we going to invent to describe the outcomes attributed to our products that was different from what was out there today? And so really, that was the role of, it's not marketing, it's really product development and understanding your customers and how are surgeons going to use this. And one of the biggest victories for us was when we ended up having commercial success. Not only did the surgeons start to use our language, but our competitors started to use our language. And so that was one of the most important things we did, was to define what are our words going to be. And then a lot of folks, if you're lucky enough to get to the pre-commercial phase, or you're about to have a product approved, what we don't realize then is that market access in healthcare is a massive issue that we have to understand. And so access means, if I get a FDA clearance, we all think, okay, I can now go sell my product to whoever wants to buy it. But then every single hospital system in America has a market access program. You can't apply for access in a specific hospital or system until you have your clearance. And market access used to take 2 to 4 weeks before COVID. A surgeon would make a call to the purchasing and say, I want to use this product, give me access, and it would be done because the surgeons told purchasing what to do. COVID turned out to be revenge of the purchasing department in healthcare. So because they were so important, because they're buying masks and gloves now, they got to reset all of the parameters of how doctors circumvented their structure, and they did it very harshly. So market access went from 2 to 4 weeks to 3 to 18 months in every hospital. And so you can't start that till you have an approval. You think you can start doing cases, but you now have to start that whole process. So our market access team, we were able to get 400 approvals in our first year, which was insane for what was a 20-person company at that point. The goal was 300. We ended up with 400. And so in our first commercial year, we were able to get, again, the model for how do you create value in this space, $1 million in revenue, 3 million, 6 million, 12. We did $1 million our first full commercial year. It's about, I guess that was about 400 cases. And then the next year we did 3 million. And we had to build our own sales team. We used some distributors, but we really found that hiring direct sales reps was the way to control how we're going to deliver that message in our language to surgeons. And it was really about targeting key opinion leaders, leading surgeons. So we tried to zero in on the top 25% or 20% of orthopedic surgeons in America who were doing ACL reconstruction and rotator cuff reconstruction and repair, and tell a story about how we were different, tell a story about the value, demonstrate with not just clinical data that we were healing, and then show that long-term results were going to be worthy of massive scale in this situation. Also, we thought, it's interesting, when I started talking to investors, one of the best things I ever did, which scared me at first, was I started to do a quarterly update for all of our investors. And the first line of the quarterly update was, we have, 3.2 million in the bank, and we spent $1.6 million last quarter, and we had no revenue, and this was our loss. And I thought, this is going to be great, or it's going to be a really bad idea. And over the course of the next 4 years, it was the best thing we ever did, because we told them what we were going to do. We told them when things didn't go right, what we were going to do. And it really forced us to communicate really well with our investors. The other thing we did for a while early on, which a lot of med tech in particular companies do, is that we have this need to kind of jump up and down and want to tell Johnson & Johnson what we're doing, or tell Stryker what we're doing, way earlier than we should. And what we learned is that scarcity and not sharing information, because most, if you are hoping for a business development transaction and you have a therapeutic business, or you have a medical technology or medical device business, what you don't realize is that there's 20 business development people at Johnson & Johnson in that particular business. Each one of them will get somewhere between 0 and 1 deal done per year. And so they typically are working from January to April to figure out what the highest likelihood of a deal they can get done for January is going to be. And by May or June, they've zeroed in on what that company is going to be. And from September on, that's the only thing they work on. And so you have to kind of so we just found trying to give them as little information as possible and wait until they started to come to us. And so that was learning that was important. Problems. What I would tell everyone on our team is that we're in the problem business. And so we would have an existential crisis once every 18 months in our 9-year history. And that could range from, we had a fire. The biggest purchase I ever made was an electrospinning system, a big metal box that would spin fibers out of collagen, and spent like $180,000 on this thing. It came from overseas. A forklift bumped into it and cracked the front of it, and I wanted a new one. They wouldn't give me a new one. They came and repaired it. 3 months later, on a Friday night, overnight, it burst into flames. And a fire started from the master control board, had a crack in it, a fire started. And no flames came out of the metal box, but enough heat triggered the sprinkler. We were in a lab building at Old Dominion. And what I learned about sprinkler systems in these companies, it doesn't matter how many sprinklers go off, the same amount of water goes through the hole. So if only 3 sprinklers go off, there's 20,000 gallons of water programmed to go off. They will come out of 3 sprinkler heads until they're done. And so we flooded our building. We did about $2 million damage to the building. The Old Dominion payroll office was below our lab. So ODU missed a payroll because we flooded their computers. And so anyway, and you thought that was a catastrophe because we were supposed to be making the products for our critical preclinical animal study. And what ended up happening was we were down for 28 days. And in 28 days, we were able to have an alternate system up and running and keep things on, just because the team was focused and everyone worked super hard. And even closing out with the insurance company, we needed a $400,000 payment that we were getting. And it was, I still remember, they kept dragging us out, and we had one milestone that we were going to miss for DARPA that was like $1.7 million. And I remember the fun of making the phone call to the insurance company saying, you can pay us $340,000 you owe us, but on Monday it's 2.1 million because you caused us to miss a milestone, and we had revenue protection in our insurance. And a FedEx arrived on 2 days later with a check because they didn't want to have to pay. So fire. The other big problem we faced was in our critical animal study, we had to show tissue growth for a year, but then you also had to demonstrate that inflammation was completely gone in these animals. So that a 52-week study became 72 weeks. And again, you're thinking about how soon can I file this? And it's an extra 20, 25 weeks. So that was a delay. And then we got our first product cleared. It's called Tapestry. It's this implant for soft tissue, but we didn't have our instruments done because I didn't have enough money to do with insertion and fixation. So we needed an instrument to put the implant into the cuff, and then we needed an anchoring system to put it in. So it caused us to have to look at other market opportunities. And so in total shoulder repair, they actually cut your subscap and open up a pocket to repair the shoulder. And so we refocused on subscapularis and had tremendous results. So we thought we were going after the big market of 900,000 rotator cuffs a year. But because we had this 1.5 year period where we didn't have instruments for rotator cuff, we built our business on subscap, Achilles, and anyone who's had an ACL, they take your quad tendon or they take your patella tendon strip. So they were using our product in those areas. So instead of focusing on the big market opportunity, we started building our revenue stream on these smaller markets. So it was just making adjustments. And it was really about, how do I build a sustainable business? Even though we knew in our space, the exit is you sell it to a big company. The reality was that you have to build a sustainable business. You have to demonstrate to surgeons that your product is relevant, and that's the only way you're going to get an exit. And people who feign that are destined for failure in medtech. It's 100% you will not get a sale without having revenue. It just doesn't happen. You can do it in the drug business. You cannot do it in the medtech business. The key to us to building a sustainable business, just make sure I don't miss a couple of things here. For us, the key to building a sustainable business was really language, market access, and our own sales team. So we knew how we wanted to position our product. We knew we could describe the outcomes that the surgeons and the patients were going to see from that product. We built a market access engine that, for our size at that point, we're a 25 or 35 person company. 150 people companies didn't have as good a market access team as we built. And then our sales team, we went from 3 to 9 salespeople to kind of really control who are the surgeons we're going to target, how we're going to have those conversations, and how was that going to work. And so our whole experience was really just this: build a sustainable business, demonstrate that the market opportunity is huge, show that you can generate revenue, and then get the attention of the companies that would see you as kind of a value add. And for us, couple of other things. Virginia was just an incredible home field advantage for us. You know, everything from Virginia Venture Partners participating in every round, Catalyst winning a couple of rounds, CCF, the old CRCF grants, you know, being a part of the Virginia Bio board. I actually met the scientist co-founder. I sat next to him at a board meeting for VA Bio once, 15 years ago. And that was how we started talking about collagen. And when I had this idea, he was the one I went to at Old Dominion, and we started this company. And so the community here proved to be a tremendous strategic advantage. Probably 20% of our whole company was Hokies, just engineers and PhDs, but lots of them for all over Virginia. When it came to investors, our investors were really Virginia centric. I raised 30 million in 3 rounds. Close to 10 came from Virginia. 757 Angels down in Hampton, Norfolk. probably near 8 million just from 757 Angels and folks associated with that over the whole 3 rounds. And then lots of different groups in Northern Virginia and some groups all around. We really resisted the whole VC process. You know, you think you want to tell your story to VCs, you want to attract venture. The reality is that venture has a very specific model. They want to find when you've got enough evidence and you look like you're going to be successful, but you're still tired and maybe you don't know that you're going to be successful and you're willing to do it on their math. That tends to, one, will crush value for the folks who are in early, but 2, they're playing on your heartstrings because they say, you want to, you know, I'm going to give you 3 years worth of cash. You can stop raising money because raising money is really hard. What we chose to do was we would raise enough money to get us kind of 12 to 15 months in the future, and then know that we would raise money again. But our experience was 85 to 95% of our money in each subsequent round came from the investors in the previous round. So we didn't have to find new people. We just had to communicate really well with the folks that we had, and we were able to do this. Also very interesting when, you know, your in-laws and your best friends and you know, the friends and family for us became this mega group of people, individuals who had invested 7 figures in our company. And you go, this is going to be really bad if we don't succeed, right? My 2 best friends are into this for big bucks. When venture came and wanted to come to us, it really was around the time of we'd closed our B round. And we had 3 really well-known medtech venture funds wanting to give us 30, 35, $40 million. So the message there was work really hard through all the uncertainty for 8 years of this 10, 11-year process so that we can take half the value of the company in the last quarter of the game. And so we kind of stayed away from that whole thing. And when I knew it was going to work was February 5th, 2021, snowy Saturday. We were invited up to Johnson & Johnson on a Saturday to do a cadaver lab. They had 10 surgeons come in. We spent 4 hours doing rotator cuff surgeries, and they did 10 procedures with our rotator cuff product, and it went between 2 and 5 minutes each, and it was just a home run. All the surgeons were crazy. Everyone was enthusiastic. In the meeting afterwards, Johnson & Johnson said, we're going to make an offer. We want to own the company. And so that was February. February turned into, let's see, March, April, May, June, then it's 4th of July, then it's end of the summer. And so we finally gave up on waiting for J&J to kind of make this takeout offer for us. And we started a process. Our Scott Meza at Greenberg Traurig in Tyson's, a great friend for 20 years, was our attorney. Guggenheim, we hired Guggenheim to be our investment banker. We started a formal process, kicked it off on Labor Day. J&J, Stryker, Zimmer, and another 3 or 4 smaller orthopedic companies, all interested in what we're doing. The big 3 all came in with 60 to 80 people on their diligence team. So it was everyone on our company had 3 jobs. So J&J diligence, Zimmer diligence, Stryker diligence. And then throughout the process, my great friend of mine, Tim Myers, also Hokie, was our CFO. He was my first investor, first board member, and then he became the CFO for the last 4 years of the company. And Tim said, we're going to do a stock deal. We want a stock deal. And we started telling all these companies we wanted to do this, the stock deal. J&J said, you're never going to get, we don't use, our stock's too valuable. We don't use it like this. And throughout the whole negotiation, we'd have these calls, we'd be hammering them. And the lawyers would call me afterward and say, you got to tell Tim to calm down. You got to tell Guggenheim, so you got to tell Tim to calm down. We're going to get a lot of money. You're not going to get stock ever. And then it was really just came down to a competitive situation. Who wanted it? Zimmer came with a stock deal that was really incredible for our investors. And so back to the sexy part of the math, folks who invested with us in our early first round probably made 7.5 times tax-free. Second round, 5.5 times. And then we did a C round in October, so we signed the deal with Zimmer on December 21st of 2021. But I still did a C round for 10 million in the fourth quarter because I didn't want to look weak, like we're running out of money and we needed some protection. That 10 million was on our whole value creation process went, no, on a $15 million cap converted into 6 million on a 36 million post A round. Then we raised 12 on a 53 pre-money, so 65 post. And then our final round was 10 on 95. So we had 105 post money in, say, October of 2021. And in December, we signed a $275 million deal. So our C round investors made 2.5 times their money in, 6 months, less than 6 months. So the ROIs for the investors were great. Also super, super proud, back to the team part, super proud of the fact that everyone who had been with us, we had given a lot of the company, because we didn't suffer a lot of that early founder dilution in the first 4 years. Folks sometimes have to do $2 million, raise 2 on 4, raise 1 on 3 or 4. We didn't have to do any of that. So we shared a lot of the company with the team. And when we got out of this, most folks who had been with us 3 years or more got a house out of the deal. And so that's fantastic. We're able to change the lives of more than half the folks in the company. A couple of things, I guess, the takeaways, couple of takeaways for me. This was really all about mindset. And what I thought was an exercise in technical science and clinical science and patents was really an exercise in managing people and building the right team and growing that team. And so everything is a people problem. And the other thing was managing the culture that you want and planning for the culture that you want. And there's a couple of shifts. There's a shift when it goes from business club, when it's 4, 6 people, to when it becomes business, or when it becomes more formal product development, say, structure. And then there was a huge shift when it became more about the commercial execution than it was about the regulatory or the science. And so for us, we had to really manage that transition and the mindset and the culture. And it was all about communication, shared mission, make sure everyone knew that what we were doing. And it was urgency and execution focused. And the thing that we embraced is that things will, anyone who's got a business in here, everyone's business is a shit show. It's just a matter of, are you comfortable with the model that you have and your ability to manage it and how you're improving it over time. So the uncertainty and the adversity that is going to happen was, you just expect it. We knew we were going to have something to threaten our existence every 18 months. And so we just said, oh, the first time, the fire, I was going to jump off the roof of the building. I'm like, this is over. The second time, a study is going to go 20 weeks, we'll be fine. We got to launch a product without instruments. Okay, what do we do? So it really just kind of programmed you to say, let's get together, let's build the, high-performing teams will find a way to win. The other takeaway, sustainable business. There is no such thing as engineering a company to be sold. Build a business that someone wants to own is the only way to get a transaction like this. And even back to advantages of Virginia, our offices, we had, I think our first labs in Norfolk were $18 a square foot. And maybe at the end, we're paying $24. In Cambridge, Massachusetts, that lab space is $140 a square foot. And we had some local contractors who would come in and put the rough wood on the walls and make, get some living edge tables for a couple $100 from North Carolina. It looked like, we said, when Johnson & Johnson and Stryker come here, we want them to covet this business. We want them to want to own the business. And so a lot of it had to do with just showing success, demonstrating that we were a commercial ready for prime time business. So, a couple of other things, just in terms of, let me just check my takeaways and if anyone has any questions, we can ask some questions, but problem business, 1 second. I would say that, the whole part of when we started to craft our own language and when we started to tell the market how the outcomes that our products enabled were going to be better and why that was the best use of available funds for these type of repairs, really, really important. We talked about the day we knew. We talked about the whole benefit of the tax-free was just a kind of icing on the cake. Takeaways for me is all about the people and you know, so much so that I now think that the people part of it is more important than the technology. It's more important than the IP. The right people will find a way to get around it. Our investors were fantastic. Getting KOLs, getting surgeons involved early and getting their buy-in and validation was also key to getting them starting to use our products. And then for the whole partnership stuff, I had to really program myself because I was a drug licensing executive in my former life. And that's all we did was have these BD conversations. And I had to really clamp down on the discipline of not to want to go and vomit information to these big companies to tell them how great we were. And then what we found was when we stopped talking to them, we got more interesting to them. And when we were not accessible to them, we got more interesting to them. So that was really cool. Epilogue for me is the other thing is you hear all the time about these BioBucks deals, right? So we had a $275 million deal, 155 up front, and then a series of milestones. We've hit every milestone. We hit our first regulatory milestone. So our revenue experience, 1 million in 21 and 22. Sorry, let's see. Let me think about years. Yeah, 1 million in 20, 3 million in 2021. Then we became a part of Zimmer Biomet, just under 12 million. So went from 3 to 12 as part of Zimmer. And now this year, they're over 90% of goal on what they'll do this year. So we've earned already 200 of the 275, and we'll earn the rest. We're on track to earn most of the money. And even in orthopedics, there have been some other companies that did some deals similar to ours. And the investors had a $250 million upside, but they got 65 out of it. So it takes, you know, having that team of 60 people who then stayed with the company was a big part of guaranteeing that we were able to make our earnouts and keep going. So again, that's most of our story. You know, I also like to share just because folks here are interested in business and commercialization. The people part of this is the most important part. I found the thing that helped me the most in the people part was reading constantly. And so always having something that I'm reading. And in these days, some of my favorite books, 0 to 1, Peter Thiel startup book, very helpful. Also very helpful in helping you understand how VCs think and maybe is a little bit of a mini case in why to avoid VC. You know, this whole mindset that every single investment a venture fund makes should have the potential to return the entire value of the fund just shows you that they're thinking in a way that most entrepreneurs aren't thinking. The hard thing about hard things, there's always a way, right? Doesn't matter what problems you have, there's always a way. The E-Myth, every business has an algebra equation, you know, and I truly believe that. You just got to figure it out. And the other one was the Art of the Long View, the Peter Schwartz classic book on planning, just that you can think about what versions of your future exist and kind of work backwards to anticipate how you want to do that. So anyway, that's my experience. I don't know if anyone has any questions about anything I said or wants to share any comments, please.
Earlier, you used the word focus. Your team was focused. You mentioned that when you talked about fire. So help us understand what you mean by the team was focused.
Yeah, I think that people knew that the business was threatened and that if we didn't get through this meeting, we had a fire in the corner of our major lab where we're making a product for a clinical trial that has to start in 2 months. So we better concurrently clean up that smoke-filled lab, get it cleared, get the insurance money paid for, and get operations. We had to build all of our manufacturing equipment. So that meant that folks had to work, you know, we had folks working 15 hours a day just to get through that phase. And it was, a lot of it was just, there's no option. If we don't do this, we can't say that we're going to lose 6 months because of the fire, because then we'll run out of money. And so it was really just making sure everyone knew that we had no choice but to get it done. And, that also, it's easier to manage people when you're transparent about ownership and incentives too. So everyone who was being asked to work 15 hours a day for, say, 2 or 3 months understood that they're a part of this, and this is going to directly benefit them. And so one of the things that I think is difficult, it's always hard. There's all these transitions of when founders have to think about giving up ownership, and the team one is the easiest one for me, because as soon as you figure out, and I also got to the point where my board and folks would criticize me of saying you're giving too much equity to people, or you're giving it too, now it would still have to vest and it would still have controls on it. But I would rather get the kind of the kicker effect from people believing that they're going to be a part of this than wait and say we don't have another 6 months for you to prove that you're going to help me get through this. We need to get through it now. And so alignment of comp became a big part of that. And the other thing through the this whole process was kind of 15 to say 24. There's no such thing as getting the best people to come and work for 70% of what they're worth and give them more in stock. We had to pay people near market and give them bonuses and give them incentives and still have benefits that were comparable, because you're competing for the best people you could find. So we had to do that. Anything else? Yes.
I was just curious about your product. In a way, you mentioned that the surgery happens once and it has to be repeated. So it's a repeated business for surgery. That sometimes you have to have a second surgery.
Well, surgeons don't like to do revisions on their own. Surgeons like to do revisions on other surgeons' patients, not their own patients.
Okay,
right?
So you didn't have any issues.
No. It was that the idea was to delay, not have repeats, because that they just tear so quickly. And it's funny, the older we get, more folks my age tear their rotator cuff by trying to put their bag on an overhead compartment, or by tripping over something, a stair or something, and trying to break a fall. It's not. I should also say, commercial for pickleball. No one in here, unless you're 20, Mary, you can play pickleball. No one should be playing pickleball in here. It is the worst thing for orthopedics in America. Scott, I have a friend who's an orthopedic surgeon who says go skydiving instead of play pickleball. So anyway.
Any other questions for Jeff? He's going to be in the panel right after this. So maybe.
Hey, thanks, guys.
All right, so at noon, there will be a panel here on funding, and Jeff's going to be part of that. Also, there's a CRC showcase today in the training and event center downstairs. There's going to be some free headshots. Co-working here for free today. Tonight, there's halftime for Game Changer at Eastern Divide Brewery. There's going to be a lot of music there. And at 3 o'clock, there will be the next presentation, or not the next one, but at 3 o'clock, there'll be one at CoGrow to see CoGrow and the CoGrow labs and talk about a project we're doing in Roanoke, biotech incubator project. Thanks again, Jeff, and we'll be back here at noon.
Yeah, I think we're still live on the Zoom. Oh, I know that I want you to stay on there, because I've got someone on Zoom who really wanted to hear about Jeff's nonprofit.
Okay.
Yeah, the top there.
I'm so sorry.
Bonus round, here we go.
What I should have ended by telling folks that one of the things that we were so fortunate to get so much money from DARPA, and we built this on a Navy SEAL business case, that was very important to my wife and I. And as we think about philanthropy and things, I was also involved in a nonprofit called Spookstock, which pays for college for fallen shadow warriors and special operations. And I didn't mention that we started a national security company. The technology that we developed also spun into a second company that was doing tools for the intelligence community. So those experiences morphed into, I became the CEO of something called the Operator Relief Fund. So we're treating special operations, tier 1 and tier 2, JSOC level units, and intelligence community, special mission unit, paramilitary folks for PTSD. And so we have, we treat one person a day right now. We've treated 600 operators in the last 2.5 years. And it's interesting for me to get to do something now that I'm not great at, right? I'm learning how to raise money for a nonprofit, new experience. And we'll probably double that next year and focus on that. And then my wife and I also started a wine company. So we bought a warehouse in Northern Virginia and we're importing wine from Italy now. So great.
Everybody get one.
Yeah, because, you know, it's actually.